I am honored by the fact that you're watching my video right now. And if you haven't subscribed, kindly subscribe to my channel so that every time I'll be uploading these videos, you'll be the first to know. Now, today, I want us to discuss about yeast infections in women. Last time we discussed about yeast infections in men, and I'm humble that I was able to be of some assistance to some of our brothers. Now today, I want to be of assistance to some of our sisters. And I want us to just dig right in. Now, what is a yeast infection? Number one, what causes it? A yeast infection is caused by a fungus called Candida, or you want to call it in other words, candidiasis. So when you get to the hospital and they're diagnosing you, they will tell you that you have candidiasis. I pronounced that right, candidiasis, yes. And when you have a yeast infection, what do you normally feel? Like the symptoms, what do you normally feel in your system? Now, one of the things that you normally feel when you have a yeast infection is irritation in your genitals. Oh, by the way, it affects your genitals. It affects our vaginal area, the vulva. You remember when we were taught in biology, we were taught about the female reproductive system, the internal and the external. Now, let's refresh on that. The big lips. I don't have a diagram to show you with, but I'm going to try to illustrate it so that you can picture it in your brain. Eh? Let's go together. The big lips, these big lips, that normally covered with pubic hair, you're seeing them. Now, those ones are called the labia majora. Then there are other ones, there are smaller ones that normally enclose the clitoris and the urethra or urethra. Jesus! Now that one. Yes, that one. Those ones that normally enclose it, then they come down to the vaginal opening. It's called the vulva. Now those ones are called the labia minora. Then there's that vulva, the vaginal opening. Then the inside is what we call the vagina. So when you have a yeast infection, you might feel some itching around the labia minora, around the vulva, and sometimes slightly inside the vagina. You might feel some itching. And when you have a yeast infection, because for some get it for the first time and they don't recognize that this is a yeast infection, so they're kind of like, it's going to go away on its own, but it keeps on festering. My dear friends, the itchiness that comes with it, oh my, you don't want it to get you when you're in a public place. You feel like taking off your clothes and digging your fingers and your hands inside and itching. It is not something I would wish for anyone. So, if you have the following symptoms, or if you're feeling the following, if you're like your body is going through something like you're feeling some itchiness, a quite stinging itch that feels like it's not going away, and if you're having some funny discharge, hey, that brings me to something. It has come to my attention that some ladies do not follow up with their vaginal discharge. This is important because you need to learn that your vaginal discharge is different from the first day of the menstrual cycle to the last day. When you're ovulating, or when you're near ovulation, and when you're near the menses, it's not going to be the same as when you've just finished 2 to 3 days down the line, and you've just finished your menstrual. It's going to be different. So for those of you that don't track your vaginal discharge, you will be affected, because when things change, it will be very difficult for you to know like earlier, so that you can handle it earlier. Some of you will know when it has already festered and it's out of control. So it's very important that you keep track of your vaginal discharge. When you're having a yeast infection, your vaginal discharge is going to be different. Number one, your vaginal discharge is going to be thick. Number two, it's going to be white, but it's going to have some coated cheese-like appearance, or it's going to have a watery appearance. So like there's your panties. For those who don't like wear pant liners every day, it's very easy for you to notice. You find that when you're in your panty, hey, it's on your panty. My English, this top part, actually I came with one. It's easier to show you like that. This top part, it's like somebody came and poured water, And your panty, when you're wearing a cotton one like this one, I'm talking about this one, this is the center part. This is how my panty looks like. My cotton panty. Now this part looks like somebody came and poured water. So it sucked the water. Then it's like the water they poured had some particles. Now those particles were left up here. It is, and they're thick, thick. Now you can tell there is water all over here. It's like somebody was sieving something, and then the residue, and now the water is inside. Now it's not even the residue. The solid part, the solid things are left on top here. So now that's what it's going to look like when you have a yeast infection. Now, what normally causes these yeast infections? Number one, yeast infection is not always caused by sexual intercourse. So when you have a younger kid getting a yeast infection, let it not hit your mind that they're now sexually active. You can get yeast infections without being sexually active. And how does that happen? When you're doing exercises or when you're going for swimming and you stay in those clothes for too long, it's dangerous. Number two, when you've had over-the-counter medication, to be specific, antibiotics, and you've had them every now and then, it is very dangerous for a woman to be taking antibiotics anytime they want to get rid of these mild infections, cold, flu. Sometimes all you need is some fluids and vitamin C supplements. You just need to boost your immune system up. You don't just rush over-the-counter medications and you want to take them every now and then. They are going to mess up your probiotic. So avoid over-the-counter medications. Don't take them every now and then. It's dangerous. And that brings me to the part of the immune system. Eat healthy. Pizza is not healthy. Burgers are not healthy. Kales are healthy. Broccolis are healthy. Fruits are healthy. Wholemeal grains and cereals are healthy. They will boost your immune system up. Then you won't be successful. Okay, you won't be easily. Oh God, yeah, that one, susceptible, that one to these infections. Well, I did not hear myself speaking that out loud. Now, that is for those who are not yet sexually active. Now, for those that are sexually active, yeast infection is not always caused by sexual intercourse. It can be caused by, number one, the kind of contraceptives that you're using. When you're doing hormonal contraceptives, that one puts you at risk, because when the level of estrogen in your system is too high, it's a breeding place for the infection. So you need to watch out on those. Then the other one is oral sex. When I'm talking about oral sex, we are calling a spade here. I'm talking about blowjob. When your partner has a yeast infection and you're giving them a blowjob, remember, it is caused by candida. And candida is also found in your oral system. For lack of a better word, in your mouth. So when you're giving your partner a blowjob, either you have candida in your mouth or they have a yeast infection. So you're doing a transfer. On the other side, likewise, if they have candida, if they have a high number of candida, because with this infection, it's all about the balance in the system, good bacteria versus bad bacteria, which one overtakes which. So when they have a high number of bad bacteria, that's the candidiasis in the mouth, and they're giving you a clit job, sometimes saliva. Yeah, this is we need parental guidance on this one. Sorry. Sometimes the saliva might drip, or they'll just feel like, I'm gonna eat the clit, then I'm gonna feed on the pussy. So the infection, the fungus transfers to your vagina, and you have it there. Or you've had a yeast infection. It was not that much, it was just around the vulva, and then there's a penetration. So the manhood or the penis, I'm avoiding to use the D word. When it penetrates, it is going to further push this infection upward the stream. And we know with ladies, infections in us don't just like come up immediately. You cannot get it in the morning and in the evening. It doesn't work like that, but with men, it's like this. So for us, when it is pushed upside, it's going to fester slowly, slowly. Then by the time it is giving you an alert, like it's out, things are not pretty. So those are some of the causes of, oh, I forgot one too, uncontrolled diabetes. Also can give you recurrent yeast infections because number one, the fungus feeds on, that's glucose. What do they call it? Fructose or something. Yeah, the glucose in the system. When you have too much of it, with people with diabetes have uncontrolled sugars. So when the sugars are very high, your body is not controlling them. It's not ejecting them when how it's supposed to. So the excess that remain, yeast thrives in a moist environment and in a lot of sugar. That is why you are advised to eat healthy. Don't eat too much carbs because when they get to the system, they are converted into glucose, which is then with time converted into fats. So before they are converted into fats, they are glucose. And that's how the yeast keeps on recurring. And the other one is when diet, on that grounds of diet, you need to look for proper supplement or a proper probiotic. And I say proper, I mean commercials are not going to tell us the truth because they are looking for money. They are not going to tell you that the yogurts they are selling do not have the exact or the right culture. Lactobacillus. They don't, or start or what? It's called start or something. That culture, the probiotic part, they don't have it. What is left there is just syrup and chemicals. So that is not going to help you. So if you cannot get access to good fermented milk, just go for the supplements, vitamin C supplements and the probiotic supplements, the supplements themselves. Yogurt from the supermarket, I'm sorry to say, is not going to help you. In fact, you're just adding more chemicals to your system because number one, they've put sugar in it. Sugar is what we are trying to avoid and they've already put it there, so how is it supposed to help you in the first place? Yeah, it's basically like that. Now, how to prevent it from number one, from ever going through a yeast infection, and number two, if you have it, how to prevent it from reoccurring. I need you to stop taking over-the-counter medication. That is number one. Number two, I need you to invest in good cotton panties. There are two options here. This is what I'm holding. Some of you are going to call it Mother's Union. You continue calling it how you want, but it's helping someone somewhere. Yeah, this is mine. It is not new, by the way. And the sun has had a good number on it. So this is cotton panties. And if you're slaying, you want to look hot, you want to look sexy, my friends, you also have this. This is lace. Okay, partly lace. The other ones are just too lacy. So this gives the best example. So invest in cotton panties. If somebody wants to ask me, you're holding a lace, how is that cotton now? This is how it is cotton. See this middle part here? This one is cotton. You need to invest in good cotton panties. The reason as to why they keep on saying invest in good cotton panties is this. When you sweat, this lace is not going to soak up the sweat. Just going to leave it there. And you're going to be moist. And that's a breathing area. Gives very high chances of the yeast to thrive. So you need to take cotton panties. It's going to soak up everything and it's going to leave you part dry, which is what we want. And cotton is breathable. So you just invest in good cotton panties. If you have issues with wearing one that covers everything and everywhere, you can look for these sexy ones, but make sure that this middle part is not polyester. Make sure it is cotton. Yeah, and that is on the grounds of fitting. And avoid doing leggings. Yeah, avoid doing leggings. Avoid doing anything that is tight. Your kitty cat, your vagina needs to breathe. It needs free air. By the way, if you can, put on a trouser or put on a skirt, and if you can avoid, don't wear any panties. Yeah, that sounds funny, but it is liberating, right? Well, okay, for a skirt it can be a bit tricky because of the dust and everything, but if you are indoors, do wear your short, the big one that is living, that is air, that air can move in freely. You wear that one, you leave things to breathe, so that they will have enough, they will have breathed enough by the time you step out and you need to be in that dress and you need to put on the panty, or you need to be in that trouser. When you're at home, avoid wearing them. In fact, when you're sleeping at night, if you can be able to sleep naked, let your body breathe, let things breathe. But when you're stepping out there, when you're wearing, don't wear the tight ones. It's not good. It's gonna do you more harm than good. And then watch your diet. Less carbs, more fruits, more veggies. Yes, more whole meal. Supplements, probiotics, instead of doing yogurts from the supermarkets. Try homemade recipes instead of doing over-the-counter medicines every time you have an infection or something like colds. And I forgot one thing. When women are pregnant, some women when they are pregnant, they get recurrent yeast infections. So that one, I'm going to need you to go and talk to your doctor so that you know when you're pregnant, or it's because of the hormonal hormone imbalances. That is what causes it. So it's not like something to be worried about just because your body is readjusting. So I need you to go and talk to your doctor so that you know how you are and how you can lessen the chances of getting yeast infection. So thank you very much again for watching my video, and thank you for